let's say we have an asylum seeker who's in ICE custody, and the asylum seeker has needed a higher level of care for whatever reason than the ICE detention can provide. So that patient would then present to an outside hospital, and in that presentation, there's an endless deferral of responsibility between ICE and the hospital about who can access this patient, to whom can she have access, can she have visitors or family members, are there translation services, certain protections that all patients are afforded and expect, and let's say that none of those were happening. And what would you do about it? How could you intervene? I've been working very closely with Dr. Nancy Berlinger about ways in which we might create systems of safety with immigrant health. This interest of mine sprung from a case I had wherein a 26-year-old asylum seeker was in immigration detention, collapsed one day, presented to an outside hospital for a higher level of care, was diagnosed with a brain tumor, and had a host of ethical and legal issues. She was experiencing some pretty disparate treatment than other patients. There were ICE guards in her room. She didn't have access to reliable translation services. She was placed on a no contact list. And so when I got involved, I tried to go a different route and appeal to the ethics side and spiritual care to see what other kinds of services we might be able to offer her from an institutional point of view. How are we creating safeguards for these patients so that they get equal treatment and equal protection? And then it's not just a granular issue patient by patient, but how might we look at this as a more global health issue and drawing on public policy, epidemiological data, values from different systems, and use it to create something that's both adroit enough to anticipate future changes, because we've seen an escalation in immigration enforcement priorities that what was once maybe deemed a sensitive location, the hospital setting, now the sick are really a suspect class. And so how can we mobilize and operationalize policies that offer protection upon first presentation?